Osteoporosis, do you know how common this condition is? And what are some of the things that can increase your risk for developing osteoporosis? Well, today we're going to talk about osteoporosis. Now, osteoporosis literally means bone disease, okay? You have bone loss and it's a disease where there's an increased risk of fracture. There are many different causes for osteoporosis. In fact, 1 out of every 2 women over the age of 50 will develop osteoporosis, which is a pretty significant number. Now, men can also get osteoporosis, but it's much less common. A lot of people think that this is just part of the aging process, but actually it's not. It's definitely not normal to have bone loss or to have fractures simply because you're getting older. So there's definitely something that we can do about it. Now, there are many different things that can cause osteoporosis. One big category is medications. Certain medications like corticosteroids, PPIs for heartburn, antacids, certain chemotherapy drugs and even some anti-seizure medications can all lead to osteoporosis. If you've taken corticosteroids, prednisone for a long period of time, whether it's weeks, months or even years, you can develop osteoporosis from that. The next category of medications are the hormone disruptors. So if you've been on birth control pills for a long period of time, that can definitely increase your risk. Also, hormone replacement therapy after menopause can increase your risk of osteoporosis. Even some of the herbicides and pesticides that we spray on our food can also be a risk factor for osteoporosis. Alright, the next big category is nutritional deficiencies. So let's talk about that. What kind of nutrients would that be? Well, primarily vitamin D. So if you're deficient in vitamin D, you're at risk for osteoporosis. Also, if you're low in magnesium, you're at risk for osteoporosis. If you're low in calcium, that can also put you at risk. And even if you have a problem with your thyroid, whether it's underactive thyroid or you have a thyroid condition where you have a severe iodine deficiency, that can also increase your risk. Alright, next one is your gut health. So if you have any type of gut inflammation or you've had a portion of your bowel removed, or you have a digestive problem where you're not absorbing these nutrients properly, you can definitely be at risk. And also, if you've gone through menopause and your estrogen has dropped significantly, you can also be at risk. And so the question is, what can you do to help strengthen your bones? Well, first of all, you want to make sure that you're getting enough protein and vitamin D. I recommend at least 20,000 IU of vitamin D3. I would also take magnesium, at least 400 milligrams daily. And then I would also take a good amount of potassium, probably around 4,700 milligrams. Now, if you're taking a thyroid medication for hypothyroidism, you need to make sure that you're getting enough iodine. That can be in the form of sea kelp. I would suggest taking 1,000 milligrams of sea kelp if you're taking a thyroid medication. And this is very, very important because most of the thyroid medications do not have enough iodine in them. And lastly, I would recommend taking something called bone broth. You can drink bone broth or you can get it in a powder form. This will give you all the additional amino acids, the building blocks that you need to help heal and repair the bone. Now, if you haven't seen my video on K2 and D3, I put that up right here. Check it out.